Thank you very much, Federico, for the kind introduction. It's a pleasure to be here this evening with all of the listeners, where we're hopefully going to be learning a lot about a really important and fairly common disease that we see in small animals, which is SIRS and sepsis, and recognizing and diagnosing patients that might be suffering from this particular disease. So I'd like to start by just going through a quick overview of what I hope to review in the next 50 minutes. We're going to start first with the terminology that is the basis of defining SIRS, sepsis, MODS, and other abbreviations in veterinary medicine. We'll then talk about sepsis 3, which was released last year and is the basis for the changes that have occurred in human medicine with the transition from the SIRS criteria to a new definition of sepsis. Between SIRS and sepsis 3 was a second definition called PYRO, which I think deserves some attention because it has a lot of important information about the hows and whys and potentially the future of how we might better define SIRS and sepsis in small animal patients. And then we'll get to the meat of this talk, which is really trying to identify patients that are suffering from SIRS or sepsis by looking very closely at their history, their clinical signs, and then what we can do as veterinarians to diagnose SIRS or sepsis and to help keep our suspicion appropriately high and to come to a timely diagnosis in hopes of maximizing the outcome for our patients.